Hi guys, Sonia here. Okay, health update. Yesterday, I saw my electrophysiologist, which is a specialized cardiologist. He's the head of cardiology at my hospital as well. He's amazing. Really knows his stuff. He's the one who put me on Midodrine for the Syncope. Midodrine is my new best friend. If I don't take it, I have episodes. If I take it, I don't have episodes. However, if I don't get my water in, then I still have episodes. Therefore, I must always get my water in. That is a little more difficult for me now that I'm not in school. I have a difficult time drinking my water when I'm at home for whatever reason. So, but I've been doing well with it. Also, when I'm on my cycle, I have episodes. So, the solution, drink my water. He doesn't want me to compensate with the medicine because I didn't get in enough water. However, when I'm on my cycle, I can double my dose, and we'll see if that fixes it. So, I get to be one of those annoying patients at the pharmacy who has a prescription that says, take 3 times a day, except when on cycle, take as directed. And insurance companies don't like the phrase as directed. So yeah, when I refill my prescription, I get to be one of those complicated patients who needs it spelled out. So that is great. Syncope is under control. It is not gone, but it is under control. The past month, I have definitely had more non-symptom days than I have had symptom days. It gets better, I think, every day. I am cleared to exercise with common sense, he says. So basically, if it makes it worse, don't do it. So I do know that heat makes it worse. So we have postponed our first color run, our first 5K. We were going to do our first 5K July 13th at the color run in Des Moines, Iowa. However, it's actually kind of warm here in July, at least warm for here, and since I've been here 5 years, I'm pretty much adapted. So it's warm for me then. We are going to wait and do our second 5K was going to be in October, so we're going to wait and make that our first 5K. It is for the Poncetti races, for the Poncetti Clinic at the University of Iowa. It is the clinic and the #1 treatment method, in my opinion, for club feet. My daughter was born with bilateral club feet. She was treated from day 1 with the Poncetti method. One of the amazing perks of moving to the middle of nowhere was that we would get to go to the Poncetti Clinic. The man himself, he was no longer practicing at that time, but he did visit and he still guest lectured at the university. We were honored to meet him once, and then we were honored to see him again another time. Her physician is absolutely amazing. He's also from Spain, and he's an older gentleman, not nearly as old as Dr. Poncetti was, but he has been phenomenal. We did not have the surgery she required here. We were in Atlanta at that point, and our doctor there was amazing too. She was born in Houston, so we went through our casting in Houston, and then moved to Atlanta toward the end of that. Yeah, so if you have a child with bilateral club feet, I can give you a reference for doctors in Houston, Texas, Atlanta, Georgia, and Iowa. Or if you're drivable to the University of Iowa, go to the Poncetti Clinic. It is the best of the best. You can tell she had bilateral club feet. No one, they're like, what? No. Yeah, she did. She has 2 little scars on the back of each of her ankles where they clipped the Achilles tendon, and she's awesome. This is, totally on topic, huh? A health update about me, and I'm giving you my daughter's health history. Okay, so first 5K will be in October. This weekend we purchased a recumbent bike from a family that we know that is selling everything. They are homeschoolers, and they have planned and prepared, and they are selling everything and packing up into the RV, and they're going to travel the States for a few years. How awesome is that? What a great experience for their children. and for themselves. But anyway, they had a recumbent bike and they wanted to get rid of it. It is a $500 recumbent bike to buy new. I checked and they only wanted 50 bucks for it. It is used, the seat is cracked, so that's fine. We'll just fix that right up. So yeah, that's probably what I'll start with. I'll get back to doing the Leslie Sansone walking tapes. I got a Sweatin' to the Oldies at the last book sale at work for DVD, so we'll dance a little bit of that. We also purchased from another homeschooling family who's looking to move. Sorry about that, guys. We also purchased a punching bag. It's a really awesome set. It's got the heavyweight bag on one side and then a speed ball on the other side. However, it is too flippin' tall to go in our basement where all of our exercise stuff is. So my husband is just gonna put a brace between the joists and drop the bag, the heavy bag, and then we'll just store the rest of it until whenever. Because the heavy bag was more what I was interested in anyway. So that is the electrophysiologist update. That is exercise coming around the bend update. And oh yes, yesterday I had a really long MRI. They did my entire spinal cord. This is to follow up with the brain MRIs. They have concluded that I have some sort of demyelinating process occurring, whether it is the early stages of a demyelinating disease or it is a series of acute incidences. Time will tell. We did the MRI of my spine, 1, to check for any active lesions, 2, to check for any old lesions via scarring, and 3, to have a baseline on a go forward, you know, for in the future. So as far as my neurologist is concerned, if there's nothing major, he will not contact me about this. He has not contacted me so far, so I'm kind of breathing a little easier about that. With the brain one, he called me a couple hours after the procedure was over. Otherwise, the plan there is I go back in 3 months for another scan of my brain to make sure those lesions have healed or are further in the healing process. And then I will meet with him and we will check symptoms. I don't know if we'll do more blood at that time or not. I do know that from now until forever, I have to have an MRI of my brain at least twice a year, and I have to be checked for, I have to have my markers checked for cancer, lupus, and MS variants. So, that's it. That's my health in a nutshell. I feel fabulous. I love not being syncopal. Life is good. I hope you all are well. Thank you for sharing your journey, and thank you for being part of mine. And I look forward to your comments. I know I don't always respond. I suck at that. I'm sorry. I have entered a few months where I will have a little more spare time. I will try to do better. I do listen to your videos. Occasionally I have the chance to actually watch them, but I definitely listen to them. I do that while I'm working. You guys are great. You make me laugh. You encourage me. This community is amazing, and I mean everybody in my little nook, not just the weight loss community, not just the couponing community, not just everybody I'm connected to. You make my life better. So have a great day, guys. Bye.